Kindly introduce yourself.
I'm Joyce from Avenue Healthcare. We are here to support children living with type 1 diabetes.
Can you tell us why you decided to participate in the diabetes walk today?
Yes, today we decided to participate in the walk to give support to people living with diabetes within our communities and to encourage them, to show them that they are not alone. We are here to support them.
Is this your first time participating in this event?
Yes, it is my first time.
What motivates you to support diabetes management and information initiatives?
For me, as a healthcare worker, what motivates me is to see the patient get better. Because we believe we have type 1 diabetes and you have type 2 diabetes. For type 2 diabetes, of course, we know it is lifestyle acquired, and we know that our patients can actually get better once they are able to adjust their lifestyle, once they are able to be encouraged to exercise, and they are able to improve their overall health by eating better, taking their medication, being compliant in terms of taking medication, and of course, they're able to improve their general health, well-being. Yeah.
Do you know someone who has diabetes?
Oh yes, many people with diabetes. As a chronic care coordinator for Avenue, of course, those are my clients. I have so many patients in the program who are living with diabetes, and of course, I have family members who are living with diabetes.
How do they manage diabetes?
Of course, they manage diabetes. One of the ways they manage diabetes is lifestyle change, eating right. Some of them are on insulin therapy, and some are taking oral medication to be able to manage their diabetes, and of course, exercising.
What do you think about the organization that held today's event?
I would actually, first I would like to really thank them for these events and congratulate them for holding such an event to create awareness so that we remove the stigma of the people in our society who are living with diabetes. Coming out and letting people know that you're not alone out there living with diabetes. It is quite encouraging to the community, to our children, to the adults who have diabetes. Yeah, and it basically helps them to come out and be able to manage their diabetes better, condition better, adhere to treatment, especially the ones who have to inject themselves with insulin. They can actually come openly and be able to inject themselves, and they go to visit their relatives, or they go to functions without feeling stigmatized. At Avenue Healthcare, we have a program called the Live Good program, which is for patients with hypertension and diabetes. We have created a package that goes for a cost of $6,550. The amount is payable every month. Within the package, our patient is able to get unlimited doctor consultation. They are able to get an ophthalmology visit. They are able to get a nutrition visit within the package, and foot care, which is free within the package. They are able to get all the baseline tests done, which are quite a number within the package, an ECG. And at the same time, our patients are able to get their medication for both hypertension and diabetes within the package. We are able to navigate our patients. So we have doctors who follow up the patients, who bridge the gap between the time the patient is at the facility and the time the patient leaves our facility to go home. So we are able to call our patients, check on how their BPs, their sugars are, to know whether they are adhering to treatment, and we are able to know whether our patients are actually improving with the medication that you've already prescribed. Basically, the aim of the program is to make sure that we are able to reach a nutrition rate at least within 1 year. And for most of our patients, of course, we are able to we are able to reduce their pill burden in an interval of 1 year. At the same time, our patients are able to get a better quality of life because they are able to manage their condition better. They are able to work on their weight. And within the program, we are actually able to deliver the drugs within 5-kilometer radius. So it basically means we reduce the number of visits the patient comes to our facility, which, of course, many visits to the hospital exposes them to nosocomial or infections, which are acquired in the hospital. So we reduce their visits to come to the hospital. And as long as the patients are adhering to medication, we reduce their risk of getting strokes, heart attacks, and admission in the healthcare facility, which overall, of course, is able to reduce the patient cost. They're able to manage the cost better.
What are some of the biggest challenges you face when managing patients with diabetes?
Yeah, so one of the biggest challenges we have with patients newly diagnosed with diabetes, first of all, is acceptance. most of them, they don't get to accept their condition easily. You have to take them through psychological counseling so that they're able to accept their condition. Then we have defaulting of medication. So you'll find you put a patient on medication. 1 year down the line, the sugars are not stabilizing. Reason being, the patient is not adhering or they're not taking their medication. So it is important. That's why we came up with the program, so that we're able to remind the patients to check on their sugars. We're able to remind them to take their medication. Yeah, and you're able to closely monitor on their overall well-being. And I encourage them to be able to exercise and to take better care of themselves by eating right.
What aspects of this event did you enjoy the most?
One of the aspects I have really enjoyed about this event, of course, the first one is the walk. I also got to exercise today. I got to interact with our kids with type 1 diabetes. I got to interact with our parents with type 2 diabetes. And of course, to give a word of encouragement to tell them that they're not alone. We can walk this journey together. Yeah, and of course, the support that we've been able to give.
Is there anything you would like to see improved or added for future events?
Of course, for future events, more people supporting the event. And of course, to make it more meaningful, to have sugar machines being given out to our patients so that when they go home, they are able to monitor their sugars better. And trainings. So we have a Live Good program at Avenue, which is a program designed for patients with hypertension and diabetes who need seamless care in order to manage their condition effectively and of course improve their overall health and well-being.